Assalamu alaikum. Today I will talk about case of ALS. Case definition. ALS is a group of rare neurological disease that mainly involve the nerve cells, neurons, responsible for controlling voluntary muscles movement. Voluntary muscles produce movement like showing, walking, and talking. The disease is progressive, meaning the symptoms get worse over time. Currently, there is no cure of ALS and no effective treatment to halt or reverse reverse the progression of the disease. Etiology: heredity. 5 to 10% of people with ALS inherited it. Familial ALS. In most people with familial ALS, their children have a 50 to 50 chance of developing the disease. Age: ALS risk increases with age and is most common between the ages of 40 and the mid-60s. 6. Before the age of 65, slightly more men than women develop ALS. This sex difference disappears after age 70. Genetic. Some studies examining the entire human genome found many similarities in the genetic variation of people with familial ALS and some people with no inherited ALS. Clinical symptoms: difficulty walking or doing normal daily activities, tripping and falling, weakness in your leg, feet or ankles, hands weakness or clomicius, slurred speech or trouble swallowing, muscle cramps and twitching in your arms, shoulders and tongue, inappropriate crying, laughing or yawning, cognitive and behavioral changes. How to roll with the ALS. Occupational therapy should focus on teaching energy conservation techniques to the patient with ALS and his or her caregivers. Adaptive equipment should be introduced early. Upper extremity pressing can be used in cases where weakness may await joint biomechanics. Patient with poor grasp can be provided with a universal cuff, and patients with hand weakness can be pressed in 20 to 25 degrees of extension to improve grip strength. Splint orthotic. Functional splint. 1. C splint. Positioning thumb and index to compensate for thinner atrophy and to allow performance of fine motor tasks. 2. Wrist cook-up splint to compensate for wrist drop and allow the patient to perform gross grasp task with the wrist extensor muscles atrophy. Thanks for listening.